Richard Lamar Lawrence II was my fourth child. He was so beautiful, and he was born July 11th, 1995. I had the privilege of having him for 3, maybe 4 months, and he was an awesome baby. He had a fever that I couldn't break, so I knew that I needed to take him to the emergency room. When I arrived, we had tests done, test after test. Everything came back negative. They couldn't find anything wrong with him. So we were giving an antibiotic, and we were giving Tylenol and Pedialyte. I went home, tucked his cute little self in the bed with me, and I was awakened by heat. He was very, very hot again, very hot. His complexion was very high yellow. He was beautiful, and how hot he was red to the touch. I knew I had to get him back to the emergency room immediately. I didn't have transportation, so I had to call a cab again. Called a cab, I got picked up, took him in, and immediately I was being separated from my son in the emergency room. I wouldn't allow that. He was 3 months old, and I had to stay by his side. I noticed that the doctors had given him an IV, and in the IV, they gave him an antibiotic. They also had given him Tylenol to reduce the fever. They told me, after a series of tests again and different observations from different doctors, they told me that they couldn't find anything wrong with him again, and they would try and break the fever with the medicines that they gave me. And this time, instead of sending me home, we would wait till the medicine emptied out in the IV bag. Once the IV bag emptied, one of the nurses came in and said, "You can get your son dressed. You can go home now. You both look very tired." I started to pull the blanket back off of my son, because as all babies, when they get to the hospital, you have to undress them, even take their diaper off. So I noticed big, huge red spots all over his trunk area. And I didn't know what it was, so I screamed out. And after screaming out, nurses and doctors rushed in. And then again, this is where some things get blurry. But I do remember that my son was immediately taken from me and sent to ICU. He was giving a lot of tests, I think even a bone marrow test. They was trying to figure out what happened to him. Within 5 or 10 minutes of them taking my son to ICU, he ended up going into cardiac arrest. Come to find out, the big red, large spots was internal bleeding from the medication. And within 5 or 10 minutes of a hospital visit, I lost my son. He had a 4-inch gash in his chest because they was trying to attempt to restart his heart. I was able to go in the room and sit with him and hold him until one of my family members arrived. I remember holding my son for hours until someone came and took him from me. And I'm thankful I had that time with him. He was almost 4 months, 3 months and a few weeks. In October of 2014, I found out I needed surgery. It was sudden. I started having some stomach cramps, some pain in my stomach, and immediately I took myself to the doctor. Finding out that I had uterine fibroids the size of grapefruits, I was kind of upset because I've always taken care of myself, always went to the doctor, and never had a doctor told me that I was suffering from fibroids. Immediately, I was told that I needed surgery. I didn't know of any alternatives. I didn't know how to take care of myself. So I listened to my doctor and I told them I'll agree to the surgery. I was in pain. I wanted it to stop. In October, we scheduled the surgery, and I ended up getting the surgery at a local hospital. And after the doctor come out, he told me when I awoke that everything went well. He told my family that everything went fine. I stayed in the hospital after surgery for about 2.5 days, and then I went home. I went home to recover, and within the 3 days that I sat at home, I laid in the bed and I asked God to please take my life, because I did not know why I was in so much pain. The 3 days that I laid at home, I was so ill. I was sicker than before, and I didn't understand why. I remember my mother-in-law coming over to take care of a few things that I couldn't take care of, and I remember looking at her staring at me in my bed, and all I could see was myself dying, and I can feel myself slipping away to where I knew I needed some help immediately. My husband came home and he looked at me in the bed and he picked me up immediately and took me straight to the emergency room. After a 5-day stay, an infectious disease doctor was put in on my case, and she investigated what happened to me. Nobody could tell me what happened to me. And she investigated for at least a week or two. She told me that I had got an infection from a blood draw, a 16-letter word infection. And when I look at it now and I read about it, that infection gives you 3 days to get help, and you experience cardiac arrest, liver failure, kidney failure, all type of failures that I felt, and I knew what was going on in my body. I knew I was dying. I got to the emergency room, I got to the doctor, I got help. I stayed in the hospital for about almost a month, getting antibiotic doses, treatments to get me back to health. When I got discharged, I was 88 pounds. And the whole time I was in there, sleepless nights, night sweats, shakes, I would get on my knees and I would ask God if you would forgive me for asking my life to be taken. I promise I will get out of here and take care of myself, and I will use myself as a vessel to help others. I will show people how there's alternatives, how you are not stuck with what people tell you. God answered my prayers and I was discharged. I was a smoker. I smoked cigarettes for years. I've never picked up another cigarette. I've never did drugs. I've never eaten unhealthy again. And I've used everything that happened to me as a stepping stone to get where I'm at today. My name is Sonia Flunder-McNair, and I am the founder of SONIA Organics.